Well, friends, you have now seen the entire spectrum of Audrey Denny, from professional hair and intense eye makeup on the TV commercial to laying in a hospital bed with this stunning designer gown. A few weeks ago, I heard my doctor say something that we all dread hearing. That lump isn't supposed to be there. What we thought at first was a run-of-the-mill ovarian cyst turned out to be a football-sized tumor on my ovary. Luckily, the tumor turned out to be benign. Now that I've had surgery to remove it, I'll need no more treatment. I'm healthy, and I will be back on the campaign trail soon. This experience has made me reflect on healthcare in America and the unique challenges facing California's 1st District. And I know more than ever that Northern California needs a representative committed to fighting to improve our healthcare, instead of voting to take it away. I became a full-time candidate in February of this year, and I took a leave of absence from my job as an educator. Luckily, my amazing employer convinced me to continue my health insurance through COBRA. I almost let it lapse. If I had, this experience would have left me with nothing. I have $600 in my savings account, and the bills would have drowned me. 2/3 of bankruptcies in our country are related to a medical crisis, and I was almost one of them. Our healthcare system is broken. It's not designed for patients to receive the care they so desperately need. It has been hijacked to provide profits to insurance and pharmaceutical companies. California's 1st District has many unique healthcare challenges of its own. Our entire 11-county district is rural or remote rural and medically underserved. People drive hours and hours to see a specialist, many times having to cross state lines. The nearest specialist capable of performing my surgery was located several hours away, and in order to avoid waiting weeks or months for my operation, I ended up seeing a surgeon up in Oregon. But our district isn't just underserved in special circumstances. In 2 counties I will represent, women can't deliver their babies in hospitals because our healthcare facilities are underfunded and understaffed. Our hospital administrators spend their days stretching dollars and resources to delay facilities from closing. Healthcare in America is broken. Our rural district in Northern California is even worse off, leaving me with one question. What has Representative Doug LaMalfa done to help fix that crisis? Nothing. He has voted again and again and again to take away our health care while voting to cut taxes for himself and his wealthy donors. The list of votes negatively affecting health care, and specifically women's health care, is long. But in January 2017, our representative voted to allow insurance companies to charge women higher rates than men. And in September of 2015, he voted to restrict women's access to life-saving health services. He has repeatedly voted to defund critical rural access providers, and I am running to take his job. I am running for Congress because Northern California needs a fighter for health care. We need somebody who will fight with everything they have to make sure we all have access to the health care we need. I will protect women's health and the preventative care that saved my life. I will fight for a healthcare system that doesn't bankrupt people when they get sick. I will fight for your life the same way the doctors and the nurses here have fought for mine. Northern California needs Medicare for all, and as your representative, I will fight every day to make sure that becomes a reality. I am grateful for the hands of the skilled surgeon who removed this tumor from my body, a body that is now free to function as it was meant to. A tumor is nothing more than a collection of cells multiplying out of control, taking up space and causing pain, and pushing the useful parts of us aside as it grows and grows. Too many of our representatives are just taking up space. It's time to remove them. It's time to replace them with representatives who will work as they were meant to. Representatives who will work with decency, integrity, compassion to get stuff done for hardworking everyday Americans. It's time for all of us to stand up and demand better, to demand a representative who will fight to protect our health care and stop the corruption in Washington. It's time for us to elect a representative who will fight for a democracy that works as it was meant to for everyone. I am Audrey Denny, and I am that representative. Join me.